So let's take a look at our leg model, okay? With this particular leg model that we're looking at, you'll notice that it has the sacrum attached and half of the pelvis, right? Not all of the leg models that we have in lab include the sacrum and the pelvis. Some of them just start on the proximal thigh. So if we've got the sacrum and pelvis here, we can see a couple of our hip flexors. This muscle here that's cut is referred to as the psoas major, okay? The origin comes off the lumbar spine, and then it works its way down to leave the pelvis and work its way out to the proximal femur. When this muscle contracts, it can flex the thigh or hip, or because it attaches to the lumbar spine, it can allow for flexion of the trunk. Lateral to that, you remember this bony ridge from our earlier unit, that was the iliac crest. And if you recall, looking at the ilium, there was a broad depression here on the anterior surface, a bony depression. I'm not talking the muscle. That depression was called the iliac fossa. Now we can see that there's a muscle that occupies the iliac fossa, and we refer to that as the iliacus. The iliacus also leaves the pelvis and crosses to insert into the thigh. So collectively, since both of these muscles have a similar function of thigh flexion, we often refer to them collectively as the iliopsoas. So in a practical, if I were to ask you the common tendon of insertion, which you can see here in the proximal thigh, I would go with iliopsoas. If I asked you for only this muscle or only this muscle, then we would go with psoas major and iliacus. Once we leave the thigh, we've got a couple other muscles that we can take a look at. Collectively, many of them are responsible for taking the thigh and bringing it back into the midline. And we call that movement of coming to the midline adduction of the hip. So I find my iliopsoas, that is not an adductor, but when I go medial to that, I see this broad muscle, kind of square shape, comes off the pubis and goes over to insert into the femur. This muscle is referred to as the pectineus, okay? If I go medial to the pectineus, I get to this muscle. Very easy to see from the anterior view. This muscle is your adductor longus. Again, going from the pubis over to the femur, and it's going to allow the thigh to come into the midline. We call that adduction. I go medial to the adductor longus, and I find this most superficial muscle of the medial thigh, and this long giant muscle is referred to as the gracilis. Oftentimes you'll hear this called the groin muscle, and you'll see when people strain it during an athletic event or whatever, they often come up holding the inner thigh. If I take the gracilis away, I can see this super big, deep muscle, again we're medial here, that lies underneath the adductor longus. This big giant muscle is referred to as the adductor magnus. And I can see it here with this medial view. It takes up this whole medial compartment of the thigh, huge. And it's going to insert, again, into the femur, part of which is going to come down into the adductor tubercle that we found, if you recall, near the medial epicondyle of the femur. The last adductor that I can show you is if we take off the adductor longus and remove that, deep to it, we can see a smaller adductor brevis. Okay, so if I can kind of reconstruct real quick and put these back on, I can show you the adductor muscles of the thigh. This top one we're going to come back to in a second, so I'm going to take this long one off, get it out of the way, and I have my pectineus, my adductor longus, take that off, got my adductor brevis, I've got the medial gracilis, and then when I take the gracilis off, you can see the totality then of the adductor magnus. Okay? Okay, let's take a look at the anterior or ventral view of the thigh. Okay? First thing I want to show you is this big, giant, long, strappy muscle. Longest muscle that we have in the body in most cases. This muscle is referred to as the sartorius. Okay? The sartorius sometimes, at least in older circles, is still referred to as the tailor's muscle. If you think of a tailor, someone who's sewing clothes together, perhaps they sit cross-legged. I'm not sure where that name came from. If I find the origin, the sartorius comes off the anterior superior iliac spine, so we're on the pelvis. It's going to cross the hip, work its way all the way over the thigh, and it's going to cross the knee joint to insert into the tibia. Since the sartorius crosses two joints, it's going to have actions on both of those. So look at the orientation of the fibers. Imagine the fibers pulling towards each other. Contraction of the sartorius is going to allow for flexion of the knee. It's going to allow for flexion of the hip, and it's going to allow for external rotation of the hip. If you put all those actions together, flexion, flexion, and external rotation, it's going to put your leg in a cross-legged position, like if you were sitting crisscross applesauce or something like that, okay? While I'm up here near the anterior superior iliac spine, I see this muscle here that just faces laterally. That muscle is referred to as the tensor fascia lata. And when the tensor fascia lata contracts, it's going to do a couple things. It's going to help flex the hip. It's going to medially rotate the hip or internally rotate, and it's going to do slight abduction or abduction. The tensor fascia lata, or TFL sometimes we call it, inserts into this broad connective tissue that runs its way all the way down the lateral aspect of the thigh. And we call that, often you'll hear it referred to as the ITB. We refer to it as the iliotibial band, or sometimes you'll see the iliotibial tract. It generally does cover most of the TFL, and you can see some of it, the remnants here. But again, this is just a model, and here the TFL or the ITB was cut a little bit so you could see the musculature. So that's what that long connective tissue is. So we'll come back to the front, and we'll get our sartorius out of the way. And when I get the sartorius out of the way, if I can get it out of the way, we have what we collectively refer to as our quads, or our quadricep group. So you hear quadricep, you'll hear quadriceps femoris. What I need you to understand is there's no such muscle as the quadricep. It's a group of 4. So the 4 muscles of the quads all have a common insertion into the quadricep tendon. That's going to work our way into the patella, and then from the patella to the tibial tuberosity, we have then, if you remember from our last unit, the patellar ligament. So all 4 quad muscles, when they contract, are going to extend the knee, or we could say extend the leg. So the superficial muscle that sits up top is called the rectus femoris, right? Rectus means straight, and femoris is telling you where it's at. When I take that rectus femoris off, I can see the other 3 muscles that all start with vastus. I've got my vastus medialis, I've got my vastus lateralis, and then deep to the rectus femoris, I have my vastus intermedius. So while all 4 muscles, vastus medialis, intermedius, and lateralis, and rectus femoris, while all 4 muscles have a common insertion, only this one, only the rectus femoris crosses the hip joint. So the rectus femoris, because it crosses the hip, is able to flex the hip. The 3 vastus muscles, they don't cross the hip, they come off of the femur. So they have no action at the hip joint, only at the knee joint, and that's an important distinction for you to make. Do you notice when I took the rectus femoris off, now I can beautifully see this big, giant, long common tendon that's coming from the iliacus and the psoas, a much better angle of what we would call the ilio-psoas insertion.